Welcome to Overcome Podcast. In today's episode, I'm going to talk with Dr. Emily Krenek. Dr. Emily is a physical therapist, but she was a soccer player on her senior year, and she had a ACL injury, which led her to completely miss her last season playing soccer. We're going to talk about that injury, the recovery time, the mindset, and also her experience as a physical therapist dealing with patients with the same type of injury. So, great conversation. Stay right there. Welcome to Overcome Podcast, Dr. Emily Krenek. How are you doing?
I'm pretty good today. Staying inside with
Thanks.
this cold weather.
Yeah, thanks a lot for your time today. I know that it's a Sunday. It's a snowing day in Texas. So
Yeah.
you could be sleeping, but you're here recording this. So thank you.
Yes, I'm excited.
All right, doctor. So to give a brief introduction, Dr. Emily, I met her during my rehab, and we were talking about overcoming obstacles in physical therapy, and I found out that she was actually an athlete, a soccer player, before entering the physical therapy school. Is that right?
Yes. Yep. Played soccer at a D2 college out in West Texas A&M.
And then what happened to you?
Well, my senior year, I think it was the second conference game in, I ended up tearing my ACL senior year.
And just to, I already know the story, but just to make it very clear to the audience how it was, how did you do that? It was a very aggressive tackle or most simple thing ever.
No, it I wish that it was something I could blame on somebody else as much as I wanted it to be a tackle. I was one-on-one with the keeper in front of the goal. Someone has sent a through ball. I took a step with my left leg and just felt almost like I didn't have the big pop that most ACLs you hear about, but mine just literally felt like if you were to take a piece of paper and just like rip it down the middle. Kind of felt that in my knee and fell, kind of got up, and I was like, oh, that was weird, but you're okay, you're good. Got up, took a step, and fell kind of back down, and I was like, okay, something's wrong. This is different. Um, Trainers
Did you
came
leave the
out.
field immediately?
Yeah. I tried a couple of minutes. I tried to take some steps, and then that's when I realized something's wrong. Trainers came out and walked me off the field, which is, pretty standard if someone's down for more than a couple of minutes. Trainers come out to check you out, make sure everything's good. They kind of took me to one of the tables off the field and started doing all the tests, and this the whole time they're just like, okay, we're just doing all this for precautions, we just want to make sure, and they're not telling me anything. They're just like, we're going to sit you out this game just in case. No one really ever confirmed it to me. Kind of like setting my hopes up, and put me in the big brace and everything, but still at this point I'm not playing, but I'm like, didn't tear my ACL, I'm fine, I'll be back practicing Monday. And then found out they got me a doctor's appointment the next day at like 8 a.m. And again, I was like, they just want to get me in. They want to get me cleared so I can be playing this week.
Well, but in
And
between the game and going back home, what did you do? Did you put ice? Were you able to walk, or you were
yeah,
completely
I mean,
isolated?
at that point, I was able to walk, but again, I was in the big like ACL brace from like your thigh to your ankle that you see. They had put me on that. I was icing, and then we just rode the 6-hour drive on the bus back to school. So yeah.
And then did you do a MRI to be certain that it was ACL?
Yeah. So the next day, I went into the doctor, and again, he did all this. He did all the tests, and they scheduled an MRI right there. But he was the first one to actually say the words. Like he did one of the big ACL tests, and he looked at me and he told me your ACL is gone. But he was the first one to finally say the words out loud. And my trainer was in the room with me. He's the one that took me to the doctor, and the doctor left, and he kind of just looked at me and was like, I knew the whole time, but I didn't have the heart to tell you. Like, I didn't want to be the one to ruin your senior year.
Wow.
So he had known, when he was assessing me at, the time of injury, but no one was able to just flat out tell
And
me.
from that point until surgery, how many days?
I actually waited about a month and a half till surgery
Oh, that's a
because,
lot.
yeah, it's not common, but it was my senior year, and the doctor kind of was like telling me like there's a small percentage of people are able to play without ACLs. They're able to get back into their sport and just daily activities without any issue. He's like, I'm not saying this will happen to you, but there's a small chance.
Mm-hmm.
And so I was like, okay. But also the main thing we ended up waiting for surgery was because it was my senior year, and I wanted to still travel to all the games. I wanted to play my senior night.
Right.
And so in order to actually travel and to like step on the field, he told me I couldn't have the surgery prior, just because I would have had, the open incision and everything, and he wouldn't have let me travel or do anything. So that was kind of the main, after I figured out I wasn't going to be able to play, that was my main thing waiting, was so I could still go to every game and I could step on the field my senior night.
Was it psychologically, was it good for you to do that, to actually go to the game and see people, your friends playing, and you be on the sideline? Because I interview a lot of people that said, well, I just wanted to be isolated, I didn't want to be around because I felt that I didn't feel like being in the sideline, so I didn't want to go. So it looks like in your case, you actually wanted to be around.
Yeah, and a big part of it was I was a team captain my senior year, and so I felt, I felt like I needed to be there for my team.
Makes sense.
But also I knew that if I like isolated myself, it would have made it a lot worse. Like if I would have just shut down and completely, because it was already hard enough that soccer was my life, and it was taken away from me in my last year ever playing. And it was hard. There were some games it would be a great game. We'd win, and like we'd get off the field, we'd go back to the locker room, and it would just like immediately I would start crying, like out of nowhere, just because like everything hit me that like
Right.
we had a great game, but like I wasn't on the field scoring goals. I wasn't out there helping my team, and just like being able, like, or just watching and knowing like I couldn't step on the field. There were definitely a lot of games that it really hit me hard. But now looking back, like I couldn't imagine not going and just being there to like support my team. As hard as it was for me mentally, I had to be there for my team.
But during those times that you felt this and you suddenly start crying and everything, what really helped you to move on? Was the teammates, or it was just your mindset?
Yeah, I definitely, my teammates, I had a really good support system. Everyone knew how hard it was for me, so everyone made a point to really include me, and kind of, make me feel like I had a part of the win. They were really good about that. And my best friend, she was like my roommate at the time. She knows me so well, so she knew exactly what we need. Like, what if I was having a bad day and she could tell I was down, she'd tell me to get in the car and go we're getting ice cream. Like I had a really good support system. My family wasn't around, but they were great, even though they were 7 hours away. So I had a lot of good people on my side to kind of keep my spirits up.
That's great. I think that having a support system is very important. But I believe, because that happened to me and from the people that I interviewed, they had the same similarity. There were some days that I just wanted to isolate it and don't talk to anyone. And
Absolutely,
I
yeah.
think you had
And
those days too, right?
yeah, and I think sometimes you kind of need those days, um, because it does it. It's you're an athlete. You're big. A part of you is taken, and I think you need to kind of sit there on it and kind of take it in, or you're not going to move on and get past it. You kind of gotta sit there and hurt for a little bit, as not fun that
Yeah.
is. You've got to, I think, just to fully move on and soak it in.
And now comes one of the most interesting twists in your career, because then you started right away. You started physical therapy school, and
Hmm.
looks like you were not really a good patient doing the exercise that you're supposed to do.
Yeah, yeah, it is. It's funny being on this side now. But yeah, I when I got back, because I ended up graduating like weeks after I tore my after I had the surgery, went back home. So I started PT back home, and I was not a great patient. I hated it. I did not push myself. Um, and I ended up kind of just stopping midway through. I never got to the point where I was with my PT like running and doing the agility and stuff. Um, he got me back to like jogging and doing some little jumping, but then after that, I was kind of like, I have nothing that
So you
I
you
had
were
a
you were
bad.
never officially discharged by your physical
Yeah,
therapist.
I think I was one of the ones that just kind of stopped going and never called them back or anything, which is terrible. Now looking
Did
back,
did, did
um,
this drive you to go to PT school, or you already had it in mind that you were going to that school?
I actually had already before all this happened. I had already applied to PT school. I knew that's what I wanted to
Hmm.
do, and so yeah, that was already kind of the plan. And I had my interview a week after my surgery. So I kind of hobbled in there on crutches and
Wow.
into my PT interview.
That's amazing. That's amazing. I mean, amazing from the perspective that you were experiencing something that later on will be your career. Because I'm pretty sure that you already
Yeah.
treat a lot of people with ACL problem.
Oh yeah, yeah. I think kind of going through the experience has, made me love treating ACL patients. But also like I feel like I can connect
Hmm.
a little bit more just because I know the up and down struggles, and so I definitely feel like I can relate to them, which helps kind of reach them, especially on the bad
Yeah,
days.
absolutely. And during the PT school, one thing that we talk about as well is the psychological aspect of rehab. Do you also cover? Do you also have classes around that, or is more mechanics and physiology?
Um, yeah, we had one class, kind of like on the mental, psychological aspect of just general. It was a general class. We, we never had like a injury
Hmm.
specific one, which would have now, out of school and everything, like you don't realize in how much patients' mental game kind of plays into their
Yeah,
process
I
in
think it's
there.
very important. I think what I've noticed is that if you go to a rehab with the right mindset and with mental strength, it helps so much during the whole recovery.
Yeah, yeah, because I mean, you definitely can be your own worst enemy. Like if your mind's not right, if you've got the negative attitude, your rehab is not gonna, and your return is not gonna be what it should be or what you want it to be if you have that. negative look. But you see these people who come in so motivated and so hyped up. They're the ones that get out quick and get back to what they really want to be doing. So that mental strength is
And have you
huge.
experienced the same this type of pattern with your own patients?
Oh yeah, absolutely. Yeah. Um, especially with athletes. You have this big up and down process with them, um, and I think and that's where education comes in. Like you've just got to constantly educate how important your mind is.
Yep, that's something that I appreciate a lot. I really didn't have that much visibility into the physical therapy. I always lift weight, and so I always liked to lift heavy, and not being able to grab marbles with my foot was extremely
Yeah.
traumatic. And I was like, wow, how is that? And doing some so simple exercise made a huge difference. So today I appreciate way more than in the past for sure.
Yeah.
Now, going through this whole experience of having the ACL yourself and then becoming a physical therapist, what the Dr. Emily would say to the soccer player Emily to do differently?
Oh man, a whole lot. I definitely would have told myself to not not quit PT. Um, and I think I probably would have just had the more talks with myself, just pumping myself up and motivating myself versus um, putting myself down. I kind of went through a dark time through it all, and I was just so negative. It just felt like I had nothing to get back to and nothing to work for, and so definitely would have had talks about that with
Yep.
myself.
Yeah, I fully understand. I fully understand that. Did you have support from your coach as well during that time?
Not as much as I
Would like.
would have. Yeah, yeah. And I think that kind of also was hard. I had a really good relationship with my coach, and um, he when I got injured, like I remember it so well. Like I fell and I'm on the ground, and all I can hear is him yelling at me to get up, and I was fine. He was like, "Get up, you're fine. Get up, you're fine." And so I think that's also why I was like, "No, you didn't tear your ACL. You're fine. Get up. Try to keep playing." Um, and when we got off the field and the trainers assessing me and checking me out and everything, and he's like, "You're fine, right?" Like he kept just telling me, "You're fine, you're fine." And I think that also, it was my senior year. I was a key player. I started as a freshman, so like I was a key player to the team, and I don't know if it was just him like, I need her on the field or
Did you
what,
guys
but
ever had a discussion after you get the final confirmation that it was ACL?
yeah, it was like at that first practice back after my doctor's appointment. Um, he was really close with our team doctor. They were friends, and like played soccer together and everything. And so he shot him a text at, like right during my appointment. The doctor texted my coach and was like, "Yeah, it's torn. We're doing an MRI and everything." And that was told to stay in the brace, and that was official. And um, that day at practice, he came up to me and he was like, "Well, so it's really torn." And I was like, "Yeah." And he just walked away. And that was
Wow, he
really,
didn't even say I'm sorry for not believing or something.
nope,
Oh wow.
nope. Yeah. So it was hard not to have him in there. And I think he kind of came around um, later in the season, when he did see how hard it was for me at games, when he saw me
Hmm.
upset and everything. And I, I remember at one point he finally came up and he hugged me. He didn't say anything, but he just a long hug, and I think that was him, like, that was him saying, "I'm
Wow.
sorry."
Why is it so hard to people say
Yeah.
I'm sorry? I don't understand that.
Yeah, I know.
Now, with the ACL, what is the usual time to recover? Is it like 6 months, 5 months, 3 months?
It's about 6 to 9 months.
Wow, 9 months.
Research now is kind of, six is kind of on the early side. They're kind of pushing it out. Kind of that 8 month year mark is
Should be
when,
fully functional, playing games again and all that.
yeah,
Before
yeah.
that, you do not recommend even training at all.
No, you can definitely train. It's just kind of that, especially like with contact sports. That's the biggest thing. And confidence. A lot of people don't have their confidence back at that time frame. And if you don't have the confidence and the strength, then you're putting yourself at risk at like re-tear. So
Oh, so your concern is more that you can re-tear. So just for like
yeah,
5 months is not completely healed.
no,
Interesting.
no, yeah, it's a long healing process.
Yeah, I mean, if you had a problem like this in the beginning of the season, the whole season is gone, right?
Yeah, yeah,
Now,
yeah. Most people sit out a year.
wow, I didn't know it was that bad the whole year. But for the physical therapy, people are back to, for example, jogging after how many months?
16 weeks is when we kind of start like straight plain jogging.
16 weeks post surgery.
Yeah.
With your experience nowadays, how long you been on this field?
About 2 years now.
With your current experience with patients that are evolving, do you also believe that this average time to recover it will always also depends on each person because some people will push harder, some people will just have a faster healing system and all.
Yeah, definitely. Every human body is different. Some people heal quicker than others, and that's, it also kind of depends on if there's any like previous like or injury, if there's any like core morbidities, that plays effect a lot. And then also back to the mental, like people who are more motivated and positive are gonna work harder, not only in PT but outside of PT, versus those who kind of have that more negative aspect, that they're not pushing themselves, and most likely they're not doing anything outside of therapy. You'll see those kind of take a little bit
Do you
longer.
think the diet also plays a role in the healing process?
Yeah, nutrition is huge in tissue healing. It's huge.
What would be some best practice that you would recommend?
Like
Yeah.
nutrition wise, a lot of hydration, a lot of protein, and veggies. Kind of just those good
And
diet.
what to completely stay away?
What?
What to completely stay away? What would be the things that you say, well, during this healing process, you should stay away of those things?
I think all like the high fatty, sugary, all the good things that are bad for you.
I heard that
I think,
alcohol is also bad for healing. Is that true?
yeah, yeah, it's not the greatest.
Yeah, yeah. Because
But
I do not drink that much, to be honest. But during New Year's Eve, I drank a little bit, and I noticed that the next day my foot was swelling more. It was
yeah,
interesting because it was not that way during, for the most part. Usually, it's very swelling at night after standing and doing exercise the whole day, which is expected, but not really waking up with the foot swelling. And I noticed that on from New Year's Eve to New Year's Day, right?
Yeah, yeah. It's crazy. You don't realize, kind of what you put in your body is gonna affect, um,
Yeah, affects everything.
your
It affects everything.
all your tissues.
And I've been way more aware about this with the whole physical therapy and everything that we do at the rehab. Little adjustments that make really a big difference.
Yeah, yeah, definitely.
So besides the ACL, what is the other common rehab that you treat patients at the facility that you work for?
We see a lot of post-op, so we see a lot of shoulder, like rotator cuff, a lot of hip, like knee, shoulder, hip replacements,
There's a lot of
and a lot of
foot
foot.
injury as well, right?
Yeah, yeah, we do see a lot of foot and ankle, whether that's, plantar fasciitis, just like little surgeries, bunionectomies. So,
What would you agree that foot is one of the hardest parts of the body to heal because of all the gravity that is pushing everything down? And I was talking to doctor, and he said, well, some people stay with the foot swelling after surgery for a whole year just because it takes a long time to to your body readjust to that swelling.
yeah, yeah, definitely. Just in my experience, it's the foot and ankle. It can be hard, especially once the patient, if they were non-weight bearing for a long time, and then kind of getting them back into those weight bearing, like it just stays inflamed just because you're putting your body weight through it, you're walking on it, you're putting so much force that you hadn't in so long. And I mean, you are always on your feet, and so yeah, you see a longer time frame with those. Just what I've experienced so
Yeah,
far.
because some friends that I know, they had a knee injury, and it seems like way less complicated to deal with on a long-term perspective because the swelling is not really that much. Is more the
Yeah.
stabilization, I think.
Yeah, yeah. Yeah, knees don't, and it's all, everyone's different. Again, back to, everybody's different, but some people swell, some people don't. But in my experience, I just feel like the foot just wants to stay swollen so much longer than, what someone comes out of a knee surgery.
One of the things that I am also learning through this rehab is other alternatives on top of the traditional physical therapy, and we talked about this the other day at the clinic. Dry needling is one, and you are certified on dry needling. So, what is the rationale behind the dry needling, and why is it good to introduce the dry needling during the treatment?
Yeah, dry needling is something I just recently became certified in, and there's just a lot of science about, causing some micro trauma to that area will help bring blood flow to that area to help promote the tissue healing. And there's even some literature on how it can change like pain receptors, like the signals up to the brain. So it's really cool. Again, it's something kind of new, and I've got a couple of patients I'm doing on, and I'm seeing some good results with it. It's cool.
And the needle is basically the same needle as acupuncture, right?
Yep. Yeah.
But I think you
Super.
told me that it goes a little bit deeper. Is that true?
Yeah. Yeah. Most acupuncture kind of stays superficial, just kind of in the skin. With dry needling, we go deeper into tissue. We can go down to bone. You go into the muscle belly or tendon.
Wow. Yeah, that
Yeah.
hurts more, I think. You said that you have a couple of patients doing dry needling? Usually,
I
what, once a
do.
week, twice a week?
Usually, if they can tolerate it, twice a week.
And
And sometimes I've kind of with the very first one, they tend to be pretty sore after, and so sometimes I just do it like that first time we just or that first week we do it. Their next session's gonna just be a regular physical therapy session. We won't needle or anything. We'll just do our usual treatment, and then we'll try it again maybe twice that next week. But some people come in and they're like, "Oh, I was sore for a day. I'm fine. Let's try it again." So, kind of just depends on how the body reacts to it.
and you've doing this in which part of the body so far?
I've done shoulder, neck, and kind of the base of the skull, a hamstring, and a foot.
Well, in the foot, I think is really sensitive because there is not a whole lot of skin there.
Yeah, yeah. Definitely more sensitive area. Definitely, there are some spots that don't feel great on the
Yeah.
foot.
I think that I'm so pain adverse right now after the whole process that I really try to avoid needles in my foot. I went to a follow up with my doctor, and I told him that sometimes I have some shock, and he said, "Well, seems to be some nerves that are not behaving well. If you want, we can give an injection of steroids to calm them down." I said, "Well, not really. I don't want any injection right now. Let's leave as is." Because I don't want anything on my food anymore. It was very traumatic, everything.
Yeah, yeah, no, definitely. And sometimes, I mean, it takes your injury was a pretty traumatic injury to that foot. The injury itself is a trauma, and then the surgery is another trauma to all those tissues on top of it. And so sometimes you kind of just got to sit back and let it calm down and heal from that big trauma it went through.
Yeah,
And sometimes it takes a lot longer than you want it to.
it does. It does. That's for sure. I'm really happy just for the fact that I'm already walk and me able to exercise. There is a lot of things that I still not able to do. But it's, as you
Mhm.
said, it's a process. It takes time, and you just gotta really need to be patient.
Yeah, yep. Patience is huge.
It is. It is huge. Um, going back to your school years, did you do any type of internship when it was close to the graduation time in any clinic?
Yeah, so about I think the last year we had clinicals. So I went to three different long-term clinicals, all in different settings that last year of PT school before we graduated.
And you were basically working 8 hours a day on all those places, right?
Yep, yep, the full days. Yep, a full kind of 40-hour week.
There is after you graduate, can you do some sort of specialization in certain areas of your body, or is like PT in general for the whole body, and you cannot really specialize?
Yeah, no, there's definitely a lot of specialty certifications that you can get after you get the doctorate and pass the boards, and then after that you can go into specific specialties, and that's there's pediatrics, orthopedics, geriatrics, neuro. There's a lot of different areas that you can kind of specialize in.
I mean, we are talking about at least 7 years between core bachelor plus PT, right? And
Yeah,
then
yeah.
probably a
You're
couple of more if you go to some sort of certification, or this is it can be done in 1 year.
Yeah, you do your 4 years of undergrad, and then PT school is around 3 years, and then I know that there's fellowships that you can do after you graduate, and those kind of just depend those time frames. But I think those are usually around a year. I could be wrong, but with those you can still be working. you just kind of do
On the side.
the. Mm-hmm, yeah.
And what about those? Because I've seen that on the clinic, other alternatives or more advanced treatment. For example, I've seen that they have like laser treatment. Do you have any knowledge on how that treatment works? Have you done any laser treatment?
Yeah, we have a class 4 laser in our clinic that we've probably had for about a year now, maybe a little more. And that is kind of the same concept, modality wise, of um, encouraging blood flow to the area to help promote the tissue healing. And that kind of goes just down, the laser goes down into like the cellular levels, kind of heating up the ATP to like recruit blood flow and everything to the area.
But this is not only to promote healing of the tissue itself, but also for the bone.
Yeah, it can.
But they gotta be class
Hmm.
4 to achieve that, right?
I believe so.
Yeah, because there are some lasers that you can even buy at Amazon. I actually bought one, but I'm not
Yeah,
sure. I don't think it is class 4. Because class 4 is
yeah.
like more professional, I think.
Hmm.
Yeah,
Yeah, I
all
don't
those
think you can.
alternatives are interesting, and nowadays they are very accessible. As I said, I got this laser at
Hmm.
Amazon. Dry needling is something that most of the places doesn't even need to be a PT specialized place. They do it. I know some facilities here that they do. They have cryotherapy. They have dry needling, right? Because I think it only
Hmm.
requires you to have a certification. It doesn't really require you to be PT graduated.
Right. Yeah. With the dry needling, I know that you they kind of limit it on your like your background, but I know like chiropractors, other like OT and speech therapy, they they can get certified in dry needling as well, MDs.
Oh, so there is a
But
requirement on your.
I believe that you have to, yeah, you have to have like a certain background and degree. I don't think that you could like just somebody like random off the
Mhm.
street. I think you have to kind of have like a medical
Background.
um degree. Yeah.
Awesome. Doctor, going back to this the rehab phase, if you would enumerate the top 3 things that you believe are important during the rehab from the patient perspective, what would you say to a patient? If you do those 3 things, the likelihood that you're gonna improve faster is better than if you don't do it.
Yeah. Definitely one of the, top is just like participation. One of the hardest things is getting people on board about doing home exercise programs, especially when they're in pain. They have a hard enough time coming in to you, and you send them home with all these exercises. And if you're not doing the work outside of the clinic, that's going to have a huge
Mm.
effect. With PT, you see maybe them, 2 hours out of the week. You have 2 sessions that are 45 minutes to an hour. That's like, 2 hours, maybe 3 hours out of their week. That's not efficient to get through, especially if it's a, major injury or surgical. So just participation in general is huge. Um, Again, going back to your mental game and mindset, you've got to stay positive. You got to be positive. That's huge. And I would say the last one, most important.
I would say
Um,
nutrition.
yeah,
I think
yeah.
nutrition plays a big role too.
I yeah, I agree that is it's
Now,
huge.
go on
And
your second advice, which is, I mean, on the first advice, which is really performing the homework. be committed to execute the homework. What is your take when you are doing that homework like every day, but there are days that you are more sore? Do you go through that soreness and just execute, or do you believe that if you are too sore, you just skip and don't do that day?
I'm a huge, like, I want my patients sore. I want them sore after every session. If you're not sore, we didn't work hard enough, and I'm gonna ramp it up. Um, so soreness is never, it's not a bad thing unless, you're so sore, it's gone past 3 days and you don't feel any better, then maybe we overdid it. But the big thing I communicate with my patients, with what to push through and not, we kind of talk about like pain levels and scales, and I kind of go through like one, or 0 through 10, 10 being take me to the emergency room right now. And I always say, if you're getting to that like 5, 6 out of 10 pain, that's when I don't want you to push through anything. I'm okay if it's under that 5, but if we're getting above a 5, we're not doing any good.
Okay. Interesting, because yeah, there are some days that I have way more soreness than the other. Now I always wonder if should I push through that soreness because it is what it is, or should I take a day off and wait to not be that sore, right?
Yeah, and I mean soreness is muscle soreness is good. That means that you're building the muscle, like you're making those micro traumas to that muscle and you're building. But a lot of people have a hard time between, like, is this just muscle soreness or is this pain? And there's a
Yeah.
lot of pain education that you have to go through with patients. They feel something, they think it's bad, they think it's pain, but really it's just their, muscle soreness. And so there's a lot of education on um, types of pain and, what they're feeling and what's good to feel and what's bad to feel.
Yeah, but it is hard to differentiate sometimes between that muscle soreness and the injury itself, if it is something that it is causing to get worse, or it's just muscle
Yeah.
soreness. And I'm very aware of my body to understand what is soreness. But when it comes to that location, since I still have some
Hmm.
plates, I still have, and I'm gonna have forever those plates there. I sometimes
Right.
don't know, is this because of those plates? It's really hard sometimes to differentiate.
Yeah, no, it definitely is hard to decipher at times. And especially, like when there is an injury and you go through that whole process and even surgery, like there's always just that fear of re-injury. You feel something at that site and there's always just that fear of like, am I doing something
Hmm.
wrong? Did I just undo everything the doctor just did? And so there's
How
a lot of
how was your
behind that.
comeback to soccer after surgery? Did you feel extremely confident? You went all in?
Definitely not. And it's kind of one of those things, like, am I glad it happened my senior year where I didn't have to go back to a competitive level, because that I think would have been, just terrifying for me. But then again, the other side of like it took my last year ever playing. But luckily I got back to playing just like for fun. Being in PT school, there was a group of us that did an intramural team. We had like PT Olympics. So I joined that soccer team. And definitely that first game back, I was very timid, but luckily it was, just a fun, low level game. There, wasn't a lot of, there were no high stakes or anything. And so I was able to kind of get back into it at my own speed, which definitely helped build my
So
confidence.
no big
Being able
tackle or nothing that you were like, oh.
No, and that was just, I mean, I was like, if I saw someone coming at me, I just would stop because there was fear. Like, oh my gosh, if someone touches my knee, like, am I just gonna am I gonna re-tear it? And so I was able to kind of play that way. If I saw someone coming, I just stopped. And then I slowly, once I got, back into it and got more confident with it, I kind of got back to my full, I can go play a game and not think about it.
Yeah, it's interesting because I heard the other day, I'm not sure if it was in Audible or I read in an article, that if you go to a game or to a competition and thinking about not getting injury, that's usually when you can that's usually when you get injury.
No, absolutely. Like going in apprehensive, you're putting yourself at risk because you're changing the way you do things, you're changing your mechanics, probably for the worse, and you're putting yourself at a higher risk of re-injury, which is why especially with athletes and not return to sport, like I just drive home with confidence, like, and especially like getting back, like when we're getting back into jumping for the first time, and I know that they can jump onto a 12-inch box, but I'm sitting there watching, you can just see it in their eyes, and they're just, in their mind, and I'll sit there and I'm like, okay, I can tell you're not ready for this. Let's go back to the 10-inch or, whatever we were just on. Like, I'm not going to, like, when I can see a patient's not confident, I'm not going to let them do that task until in their mind they think they can.
So you do not really push, saying you can do it. You rather say, well, you're not ready. Let's back down.
And I mean, and that there's times when you push, and then there's times you don't. And this, I kind of had this specific thing happen with one of my young ACLs a couple weeks ago. She plays volleyball, and we have gotten into like single leg jumping, and we're jumping onto a step, and she was doing great, and I like increased it, and I knew she was clearing, the first box, by a foot. So I know she's going to make this, but she sat there and just, couldn't even take our eyes off of her foot. And at that point, like, I'm not going to have her do something and go kind of halfway into it and hurt and cause it,
Right.
something in the clinic there.
So what did you say to her? You said like, let's stop.
Yeah, I sat there and I was like, okay, like, we're not ready for this. Let's go back to, we're going to do, 10 more here. But then, I'm constantly talking to these types of patients that are in their head, they're not confident. You've got to build them up. Because they're not, they're just constantly putting themselves down. So you have got to constantly build them up. And we sat there, and I put a mirror in front of her, and I showed her, I was like, watch how high you're jumping over this step. And as soon as I showed her that, and I told her, I am confident in you, I know you're going to do this, we went, she was like 5 minutes later, she was like, all right, I want to try it before I go today. And I was like, okay.
And she did it. Awesome.
She cleared it. Yeah.
Yeah, that's pretty cool. And this is one of the things that I like about that rehab facility is that you start working with one physical therapist and you stay with that physical therapist the whole time. I really don't like that place that every time you go is someone else different. Because you really don't build that rapport, and the doctor does not see your evolution. One thing is you read on the notes about someone evolution. The other thing is you experience every time that this person is there, how that person has evolved. I think is extremely important, don't you think?
Oh, 100%. Like, and just having that, like, that relationship with that patient, like, you need them to trust you. And so when you're getting switched around to, it's hard to stay consistent, and, just you feel like you're being bounced around and no one knows your story and, or where you're at. So yeah, that is huge. And that is something that, at our clinic, like, if at most you'll stick just to two different PTs if you're not able to just stick with the one.
No, that's huge. I think that's super important to see the evolution, and also for you not having to tell your story many times. It almost feels like you are
Yeah.
repeating yourself. Is that you feel like people don't care. So that's very important as well. It plays a big role. I was always very skeptical with physical therapy until I started this one on that place, and most likely because of previous experience that friends of mine told me about going to a place where they were getting switched every time.
Yeah. Yeah. And it happens sadly. I've had patients come in and say like immediately, like they're like, look, I've had a bad experience. Like I don't want to be here. This, and because they were bounced around or the PT would never see them. They were just thrown to a technician and you feel like your PT doesn't care, and that should never happen. The PT should be, there, eyes on, and again, you shouldn't be bounced around between five different
And
people.
as you said in the beginning, there is something very important about trust. You gotta trust your PT, and if you don't build that relationship over time, how can you really trust?
Yeah, absolutely. Yeah. It's really, and then that's another thing that kind of affects people's like rehab. If you don't have that good rapport and relationship with your patient, those are the ones that are going to kind of just drop off and stop coming, and those are the ones that kind of just come in, keep their head down, and don't push themselves. So I really try to make a good relationship with each of my patients.
Yep, yep. And you and Dr. Brian, I think it's Brian, his name. I hope I didn't get it wrong. Ryan,
Ryan, yeah.
Dr. Ryan. You guys have been helping me a lot for this process, so I truly appreciate that. Dr. Ryan is fantastic, and good thing that he knows about my injury. I mean, because Linz Frank is something very specific. Not a lot of people actually knows about Linz Frank injury. So when he told me that he treated Linz Frank injury in the past, I was very relieved because it's a very unique injury. If you don't know Linz Frank, then it's hard to measure how hard it is.
Right, absolutely.
Yeah. So, Dr. Emily, thank you very much for your time. I truly appreciate
Yeah.
again you taking the time. I think it was a great conversation, a very good insights from you and from your experience, not only as a doctor but as an athlete as well. So, thank you very much.
Yeah, thank you for having
I
me.
appreciate your time. Take care. Thank you for everything you do.
Awesome. Thank you.